Welcome to Scrub In, a podcast powered by Bayhealth. I am your host, Sarah Beebe.
And I am your co-host, Tyler Cody.
Thank you for joining us as we ask ourselves to scrub in
and talk more about our why behind the healthcare uniform. Ladies and gentlemen, welcome back to Scrub In, Episode 7, Season 3. Hey, Sarah, how you doing?
Good. How are you, Tyler?
I'm doing good. Today we have Ben Collins, the Senior Director of the Cardiovascular Service Line at Bayhealth, and we have Dr. Rob Scaffidi, Interventional Cardiologist here at Bayhealth, joining us today.
Thanks for having us.
Thank you. Yeah, happy to have you.
Yep.
We always start our episode off with a quote, and our quote today is, "The heart is the household divinity which, discharging its function, nourishes, cherishes, quickens the whole body, and is indeed the foundation of life, the source of all action." And that's spoken by Will Harvey.
That was a lot. I'm
was-
now
yeah.
looking at it. I'm like, what
Yeah.
does the heart do again?
We're going to have to break that down a little bit.
Yeah, we're going to need to know what the heart does,
Yeah.
which glad we're talking to you guys.
Yeah. He knows better than I do.
You'd
So
like to think that, wouldn't you?
Well, you're in operations, though. You
Yeah.
make sure that everything works.
Yeah, I guess you could say it's very similar to the circulatory system and make sure everything's
There you
going
go.
together and pumping things, make sure everything's pumping, keep it pumping, right?
That's
So,
right. Keep
Yeah.
it pumping.
So we want to hear about who you are. So, Dr. Scaffidi, tell us about yourself.
Well, what do you want to know?
Where are you from?
Sure.
Start from day one.
What got you here to Bayhealth?
All right. So I'm originally from Baltimore.
Okay.
Born and raised there. Trained at, went to Loyola University. It's now Loyola University of Maryland. It used to be Loyola College when I went there. Went to University of Maryland for medical school, where I stayed for my residency, my cardiology fellowship, and my interventional cardiology
Oh,
fellowship.
you are Maryland all the way.
Yeah.
Okay.
Yeah. So I was there for 11 years before I came here, and then
Okay.
came here in 2006, and I've been at Bayhealth ever since.
What brought you out of the state of Maryland? It sounds like you were pretty, you bled black, red, and yellow. So what brought you here to Delaware?
Geography, actually.
Okay.
So my parents at the time lived in Harford County, Maryland,
Gotcha.
and my in-laws live in Berlin, Maryland. So Dover's about halfway in between.
Absolutely.
Yeah.
Yeah. Awesome. Well,
Nice.
thank you.
Yeah.
And Ben, tell us about you.
Well, it was a cold, dark night in 1987. No, I'm just kidding.
You sweet baby.
Yes.
1987.
So I'm originally from Pittsburgh area, born and
Okay.
raised. I won't hold Baltimore against you, Rob. So I went to nursing school straight out of high school. Ended up in the neurovascular ICU at UPMC, University of Pittsburgh Medical Center, and then worked myself into the neuro interventional suite. So that's where I kind of got into operations and surgical services and stuff like that, and caught that bug. And then I decided, hey, why not go into leadership? I don't know what I was thinking. But here I am. I ended up getting a cardiovascular director job at a smaller health system east of Pittsburgh. And then about 2 months after the first wave of the pandemic, I got a call from a recruiter that said, hey, there's this place in it's called Bayhealth. You know where Delaware is? I said, well, I know the state, but I've not been there. And so I got recruited here because they were looking for someone with heart and neuro experience.
Wow.
That's kind of what brought me to Bayhealth, and picked the family up and moved here in November of 2020. It was quite a time. A lot of people were like, so what's Delaware like? How do you like it? I was like, I don't know. I go to work and go home. Everything's shut down.
Yeah, 'cause
Yeah.
nothing was open.
No.
And in
Yeah.
fact, in November 2020, we all shut down again.
Yeah,
Oh, yeah.
You know?
Second
exactly.
round.
The second
Yeah.
wave. So it's been good, but really enjoyed here. Community, the people are awesome. So I think we're putting some roots down here, and really love Bayhealth, and here I am.
That's awesome.
Great.
And your spouse is also a Bayhealth person as well.
She
So
is.
she picked up and got an NP job here.
Well, so actually, where she worked before, it was a place called Matrix Medical Network. It's preventative care. It's a bunch of NPs that contract with insurance companies.
Okay.
So they actually have a nationwide footprint, and so she was able to pick up and move at that time. And
Oh,
then
nice.
after the pandemic started to slow down, she missed patient care. She did that for about 10 years, and then she missed patient care and started out with urology here at Sussex with Dr. Patak and then Dr. Bologna. and now she is with oncology up at Kent. So she has found her love and all of that patient population, and we are here, and we love it.
And now you're
Great.
Delawareans.
We are Delawareans, yes. I still catch myself when people are like, where are you from? I'm like, Dover. I'm from Dover, Delaware now, so
Yeah.
catch myself.
My brother did the opposite. He
Yeah.
was born and raised here, and now he's in Pittsburgh.
Greatest city on
Oh,
earth.
wow.
Greatest city on earth.
He still wears his Eagles gear, though.
Oh,
like,
that's unfortunate.
his wife bleeds black and yellow, and but he flies with those Eagles every Sunday. So
that goes over well.
And she took him away from Delaware to Pittsburgh, but they seem very happy there. So
I love it.
But awesome.
Yeah.
It's exciting to hear how you guys got here.
Mhm.
I'm always curious because being just only from Delaware, both of us,
Right.
you kind of assume that everybody started here.
Yeah?
Yeah,
It's
it's
true.
true.
Get it.
It's a very small world.
In
And
fact, it's quite the opposite. Everybody
yeah. So-
migrates here at some point.
Mm-hmm.
Yeah. So we always ask everybody, why do you do what you do? How'd you get here? What is your why? And so I'm kind of curious. I mean, Ben, you told us a little bit about your trajectory, but why do you do what you do?
So really, after my first 10 years, my career was in academic medicine. And when I took over that job of overseeing cath and EP lab at that smaller health system, I really fell in love with community medicine and really understanding, like, you don't have to go to the big city to have exceptional care. Like,
Absolutely.
so one of my goals there was always say everything but a heart transplant. You can get anything in this community hospital except a heart transplant, and the person that intervenes on you is the person you're going to see in the office. They're going to follow you up. Not that we don't need academic centers and training people, but
Right.
having those attendings that work on you and that's your actual doctor is really big for me, and I'm really passionate about that. So when I came here, that's one of the things that really drew me here, is that there was an even bigger need for bringing those high-end academic medicine procedures to the community. Big testament to Rob and the whole team beforehand. They were doing things way more progressively than our system was, or anywhere in the Pittsburgh area. They were sending people home same day. Post heart stent, they were sending people electrophysiology, pacemaker, defibrillators same day. That was unheard of, and we were just starting to do that, and we were just starting a TAVR program, and they adopted TAVR, which is the
Transcatheter aortic valve.
Thank you very
replacement.
much. I appreciate it.
You're welcome.
Hey, tag team.
Yeah.
But they were doing that since 2016, and I came. That was 4 years later, and we were just starting that there. So
Wow.
I was just like, these guys are already progressive, and we could just really rock it out here. So that's what I'm passionate about. It's what wakes me up in the morning, is just making sure that we're giving that awesome care, and the next step is now letting everyone know. Because I think that's our next step here, and we're looking forward to a little something coming. I'm not going to give all that up, but yeah, so that's really my why, and I really believe and truly believe that we can get and give excellent care, and we have a lot of accreditations that has shown that. We've been a Heart Care Center of Excellence for the American College of Cardiology since 2021. So it's what that means is it's excellent policies, processes, and outcomes. Outcomes is the biggest one. And then and we track all of our outcomes. Rob does a really good job at keeping over top of all those things. I'll let him talk about it. But anything that falls below the 50th percentile, we have to have a quality plan to fix that. So we are better than half the hospitals in all of the country in the majority of our metrics. And if we're not, we're fixing it. So that's really a big call to like toot our own horn a little bit. And again, we will be doing so here in the coming months, but I talk a lot, so I'll let Rob talk.
Yeah, tell us about your why. Why do you do what you do?
So I think it boils down to one word, which is service. I don't recall a time where I didn't want to be a doctor. So, I mean, and you ask anybody who's known me, my parents, my sister, any of my relatives, and Bobby always talked about wanting to be a doctor,
That's cool.
from day one. And, most people, they want to be a race car driver. They want to be a police officer or a fireman. I'm like, nope, this is what I want to be, and this is what I want to do.
That's awesome.
And, I made sure kind of early on, I knew, okay, it's going to be, I don't know how I realized it, but I realized that there's going to be a big commitment to being able to get to that point, and not only to get to that point, but be successful at it. So I worked really hard for a long time, and I had one career path that I had chosen initially, and then when I was a teenager in high school, my dad got sick, and that changed my focus as to where I was going, and that pointed me in the direction of cardiology.
That's awesome. I mean, not that your dad had an issue, but it's awesome that you had that drive the entire time, because so many folks, we try a bunch of different things before we get there, or so having that passion from such a young age is really cool. And your dad did have, a cardiac history, right? And that's what took you...
Well, he started having chest pains, and he was referred to a cardiologist. And, my parents are both immigrants from Italy, so, they knew the language, they have good street smarts, they're intelligent people, but, medical knowledge they really didn't have. Mm-hmm. So I kind of took it upon myself. I'd go to the appointments with them and have the cardiologist kind of tell all of us what was going on, and then I'd look all these big terms up and figure out exactly what was going on, so that I could distill it down for them and help them to understand.
Okay. Oh wow.
So you were learning before you were even learning.
Yeah. Mm-hmm. Actually, my dad's cardiologist was one of my first mentors when I was in college and in med school. So
wow.
Yeah.
That's awesome. Yeah, I think we all probably have been that person for our family in the room, but also having a language barrier or, any of those other issues, it's so crucial to have that family member in the room that can break it down and break it down accurately, because we also have all been in a room with somebody who has a family member that is maybe doing the opposite. And so, but that's often, a role that all of us in healthcare take on for our families, is being that person in the room that's able to break it down for those who are not in healthcare. Right. So, and you've done it from such a young age. That's really cool.
Yeah, it was daunting, but it was something that I felt that I wanted to do and needed to do, and I wanted to make sure my dad was okay too. I mean, I was selfish at the time.
Yeah.
Now, if only my wife and kids would listen to everything I said, I'd be in good shape.
Oh yeah, no, that's not going to happen.
They're like, Dad, what does this mean? I'll tell them what it means. They're like, no, that's not what it means. I'm going to see my doctor. I was like, okay.
Right.
Or my kids will be like, "Are you done talking now?" Like,
yeah,
I didn't need that much. I didn't need that much information.
You're talking about my daughter right now. My 22-year-old daughter. Yeah.
Yeah, I just needed a short answer, Mom. You didn't need to give me the science behind it.
Exactly. I feel like we all kind of do it a little bit. We just translate ourselves well. We're talking to family members, but
well, because I was in women's health, I like to embarrass my children with the knowledge I have. I'm like,
that takes it to a whole nother level, Sarah.
My kids are terrified of catching puberty, so I have a really good time talking about different health things with them. So yeah,
that's good. That's funny.
So, we know why you do what you do, but how do you care for yourself when you're such a caregiver? I mean, you see people at their worst, and you see people really scared, like you talked about your dad. And so, what do you do for yourself to care for you as a caregiver?
Well, the big thing for me is exercise. I exercise a lot. Usually if I do it early in the morning before I come into work, because if I don't do it in the morning, it's not happening.
Oh, same. Yep. Mm-hmm.
For me, it's a big stress reliever. It helps me. I have time to kind of think through things. If there's a particular patient that I'm concerned about, or a procedure I'm doing later that day that I'm nervous about, that'll give me an opportunity to kind of work my way through that. Plus, it's a great opportunity for me to catch up on Netflix and all the other fun stuff. So, so that's one of the main things. My son and I bond over NASCAR, so we go to races a lot. He's actually a sports management major at the University of South Carolina now.
Oh, wow.
So, yeah, and he actually, during his senior year of high school, was a marketing intern over at Dover Speedway.
Oh, cool.
So he's really heavily into all that.
Oh, fun.
And we kind of argue back and forth, because I'm more of a Formula One fan as opposed to a NASCAR fan, and he thinks Formula One is pretty much garbage. But it's okay.
Interesting.
Yeah.
I know the difference-ish, but what is his justification for why one is better than the other? I mean, how would you compare the two?
Well, I mean, Formula One is... there's head-to-head racing, but it's a lot more head-to-head racing in NASCAR than there is in Formula One. I mean,
Okay.
you know, you don't have, usually with Formula One vehicles, you're not bumping each other, and
Well, you don't want to bump each other with those vehicles.
way too expensive. And,
Yes.
you know, generally the top speed's a bit higher than it is in NASCAR, and you know, you've got a 3,800 pound car versus, you know, a 15 or 1,600 pound car. So if you're getting hit, you're getting wrecked pretty hard in Formula One.
Wow.
Plus, you know, there's more parity in NASCAR than there is in Formula One.
Okay.
So if you've got a really good driver, I mean, they can drive and win, you know, by 15, 20 seconds, whereas you don't see that in NASCAR anymore.
Oh, interesting.
Yeah.
Well, you do have a cat named Ricky Bobby.
Yes,
so
I
you
do.
You are obviously a racing fan.
Well, you know, it was kind of funny because we found Ricky Bobby in our backyard, and she's got a bad eye, so her mother just kind of abandoned her.
Okay.
So my son actually found her. We thought she was a he at the time, hence the name Ricky Bobby. And now
Gotcha.
it's Ricky Bobby with an I instead of with a Y.
There you go.
But she's
There's a
kind
country song about that.
yeah. But she's kind of crazy like Ricky Bobby too. She's running all over the place in the house and super fast and parkouring from spot to spot.
Oh,
So
fun.
yeah, so she's very much the if you're not first, you're last kind of cat.
That's what I was going to say.
Yeah.
What a good homage to Will Ferrell right there.
I know. That's awesome. Ben, how about you?
So I wish I exercised more. I need to do that. But I would say the biggest thing for me from a self-care perspective is balance. Work-life balance is really important, especially in management. You're always on. I carry 2 phones, and I was just telling Rob about this. I recently went on a Disney cruise, and I was really proud of myself that I did not bring my work phone. And I was also
That's a
really
big deal.
excited that I only had 375 emails to catch up on. I was like, that's pretty good for 10 days and not looking at the
Yeah.
phone. So really creating those boundaries and realizing, for me, I get a lot of satisfaction out of being not only professionally as a good manager, operations, oversight person, but being a good dad. I just want to make sure my kids know that they have a dad and that I'm there as much as possible and be as present as possible.
Mm-hmm.
So I think, like, for me, that's what kind of keeps me going. I mean, my why is passion to bring community medicine, the academic medicine community, but it's also they're the reason I go and do what I do every day. So just making sure that I'm there and I'm present, that's and then that kind of refills my tank to be the best me at work as well. So that's probably my husband. I shouldn't leave that one out. Sorry,
Sure.
Sarah, if you're listening. But no, so just really making sure we have that work-life balance and making time for family. It's a big deal. And then from a hobby perspective, I like to golf, and actually we've gotten into a family golf kind of thing. The kids kind of like it, but my wife and I really enjoy golfing, so we'll kind of take the kids out and they'll maybe swing a couple times, but most of the time they'll pull out a tablet or something like that. But it's nice to get out and swing and get some fresh air in your lungs. So those are kind of the things I like to do to.
That's awesome.
Yep.
Yeah, I was going to ask you what you do with your kids to be present. Like what activities do you enjoy doing with the kids?
So we try to make sure that we do at least a little bit of reading every weekend. What we're reading is not always like, I always think, I'm like, man, I should really start reading some like how to be a better director, manager kind of thing. But I really enjoy just sci-fi crazy things that would never happen.
Yeah.
I'm a big Andy Weir fan.
The Martian.
Yeah, very good. So we try to make sure that we make time for that. No screens at certain times. I mean, sometimes it's okay to have that break. But we kind of make sure that we are always there for they're in Taekwondo, stuff like that, just being present and stuff like that, making time with them. We'll do puzzles, try to do things without screens as much as possible.
That is a battle.
That's the biggest. It's really hard.
It is really hard.
It is. You're right.
Yes.
Mm-hmm.
Yeah.
Yeah.
When you said that about your kids, I know my husband really works really hard to be a dad that the kids know. And no offense to my father-in-law, he is a great dad and a great grandfather, but I feel like the dads of our generation are really trying to be interested in their kids' activities. And like my husband learned about Pokemon. I mean, God bless. I really, but he got into it with them and was like, there's this Pokemon Go thing. We can, not be around people and we can do this with them, because it was during COVID, but like hearing you talk like that, I appreciate that, you're trying really hard to like be on their level as much as possible. So
it's funny you mentioned Pokemon because they all were excited about like all the new Pokemon games, and I went down to the basement and I pulled out my old Game Boy, and I was like, yo, this is Pokemon Red, okay? This was really hard to get. And then I started playing it and I was all excited and I was really getting good, and then my son got on it and erased my game, and I was like,
oh no.
Because it's not like today where you can save it.
Yeah.
Oh man, they just don't know. They don't know how it goes.
I can't believe that thing turned on for you.
Oh,
it's been a long time ago.
Yep.
Wow.
It works.
Yep. We have an old Game Boy somewhere, but I don't think it turns on.
Yeah.
But my husband has gotten into Fortnite so that he can play with the kids. And I'm like, how late did you stay up last night? And the children were not playing, but okay, but you got a skin that you're really excited about and an emote that you're really excited about. But it is cool and to see dads with their kids. Like he's like, I don't know why you think it's cool that I'm just hanging out with my kids. Like I'm not a babysitter. Like I do want to be a dad, but that's not necessarily what we always grew up with. So that's awesome. That's cool.
Appreciate it.
Yeah.
Thanks.
What kind of projects are you guys passionate about out in the community? So you mentioned bringing academic medicine to the community. What is your service line doing out in the community? What are you excited about out there?
We're very involved in the American Heart Association Southern Delaware Heart Walk. Actually, there will be a press release coming out that both myself and my wife will be co-chairing the whole Southern Delaware Heart Walk next November.
And you chaired this past year too,
I've been the chair for the Just Bayhealth. This is the whole walk.
Oh, wow. Okay.
Yeah,
So you're fancy this year.
Nice.
Following in this guy's shoes. So what was that, 2 years ago, Rob?
2022, I was the chairman for the Southern Delaware Heart Walk as well.
Okay.
So we're very involved with the American Heart Association. We're looking forward to getting more involved in the community. There'll be some events coming up in the spring through the foundation to support the cardiovascular service line. So we're really excited about getting there, getting out to do that. We've had a partnership with Dover High School to do pre-screening of athletes as well as teens to try to find anyone that has the genetic anomaly that causes sudden cardiac arrest. So we've gone to the Super Senator days and done some free EKGs, and we've luckily not found anything, but there has been a couple patients or students that ended up getting looked into, and luckily everything was fine. But that's one of the things that we've done since I've gotten here.
Wow.
That's great. Yeah, so.
That's the stuff you hear about in the news. You know, that, like at least once a year there's a kid that, drops on a track or on a football field or basketball court or something like that. So, wow. Okay.
Yeah.
That's awesome. Yeah, I also do a lot, I have become very passionate about American Heart Association as well. I do Go Red, and so I know that you're on the Heart Walk side, and so Bayhealth is well represented within the American Heart Association because it is just so important. And so what does why would a patient come to you, Dr. Scaffidi?
Well, I mean, for a lot of different reasons. So I'm an interventional cardiologist, but I'm a regular cardiologist as well. So an interventional cardiologist does different procedures like heart catheterization, stents. We do vascular procedures involving the lower extremities. I also do some structural heart work. Ben mentioned TAVR earlier, so transcatheter aortic valve replacement. And we're expanding our services to include transcatheter mitral valve procedures. We're also doing some other structural heart procedures, including the Watchman, which is kind of all over Facebook, all over TV right now.
Oh, yeah. See that everywhere.
So hot right now.
That's right. It's so hot.
So So hot right
That's right. And so we're actually, Dr. Singh, Dr. Manjeet Singh is our primary person who does the Watchman procedures.
Okay.
Dr. Sanjeev Patel also recently finished training and is joining Dr. Singh. I'll hopefully be beginning training at the beginning of the year. Just in short, I mean, the Watchman procedure is basically a procedure by which we're able to close off part of the left atrium, one of the upper chambers of the heart. Atrial fibrillation is a very common heart rhythm problem that can significantly increase your risk of stroke. And we found over multiple studies that a small part of the left atrium, called the left atrial appendage, is where most clots form. So if you
Okay.
put something in there to basically plug the hole, so to speak, then you can significantly reduce somebody's stroke risk without them needing to be on big-time blood thinners long term.
Mm-hmm.
So it's something that we're very passionate about and getting that out into the community.
Yep.
Awesome.
It's huge.
Yeah, because a lot of times in the community, when you say interventional cardiology, first of all, people might not know what that is,
What does that mean?
but they think, well, I'm good. I don't need a cardiologist yet, or
Yeah.
But it's important to know like where you would go if you start having any kind of symptoms, or maybe you don't have symptoms, but it's still you have a family history, something like that. So,
And I do a lot of preventive cardiology and congestive heart failure management as well. So we kind of run the gamut,
Wow.
with everything. So a lot of times people will be referred to me just because, they're getting older and their primary care doctor thinks that, they probably should meet with a cardiologist just to kind of get established.
sure, yeah,
So, totally non-threatening, not emergent environment where it's just easy to meet someone and get to know them and kind of get the process started for them.
wow, yeah. I have worked with your department a couple of times in the Sim Center, and I'm always so fascinated by what you do. We've done 2 simulations in the cardiac cath lab, which would be on the more acute side. If somebody has a
Right.
problem, they come.
Yep.
But it is really cool to see how your department is constantly trying to improve and work on quality, and which is where we come in and
Yeah.
get to practice. We did a sim a few months ago where we actually had a procedure going on and a resuscitation at the same time, and to navigate that, which was pretty
That
pretty
was
cool.
fun.
That was a
Yeah.
lot of fun.
That was a lot of fun.
That was fun to plan
Wow.
and fun to do, and
Yeah.
we like to highlight that in the sim center.
Yeah.
We're like, look, we had nurses and doctors, and the docs were doing a procedure and this and that, and that's what we get jazzed about.
Yeah.
So,
Oh, absolutely.
Sure.
so yeah.
Really gets us going.
Yeah. Yep. So, but awesome. Well, what kind of innovations are you starting to see? What are you bringing to Bayhealth that you're really excited about as far as technology and that sort of thing?
I can take this one, Rob.
Go
if you're
for
all
it.
right with that.
Go for it.
So,
I'll add in.
So we recently just upgraded one of our cath labs to a biplane, which what that allows us to do is neurologic interventional procedures.
It also allows us to save contrast in people who have underlying kidney disease.
That is
so
correct.
Okay,
we're
so
trying to
those
limit
people
the-
who can't have, that extra dye in their
Exactly.
system. Okay.
Yep. And so that, and it is also a hybrid OR. So one of the things that we're seeing a lot of over the last several years, and it is projected over the next 10 to 15, is most procedures are coming out of the OR and getting done in cath labs. So you still need
Okay.
the ability to convert to an OR
Right.
if something were to, God forbid, go wrong. But things like TAVR, like he said, you used to have your chest opened up and an aortic valve replaced that way. Now we can do it through your groin. Watchmen, the way that they fixed the left atrial appendage before was open your chest up and put a clip on it.
Right.
Now we do it through your groin. So again, we're keeping up with the rest of the nation. I'm proud to say, especially with the mitral program, we did do our first mitral valve and valve. We're still working on the mitral clip. So those are all things that we're really excited about that are coming to Bayhealth or already started. The other piece is the expansion to the south. So we've been working really hard to utilize that. We do have a cath lab at Sussex. And so it largely was unused because we did not have reliable transport to be able to do PCI or do a heart cath without surgical backup on site.
Right.
So, but we've been able to get more and more comfortable, and as we add people to our staff, we have the ability to do a cardiac window. So essentially, if something bad happens and you're bleeding into your chest, we can do a little, we can relieve that pressure. So, and stabilize you before we have to get you up there. So it's not as emergent there. So that has allowed us to really expand our services. So now we can do pacemakers, we can do ICDs or the defibrillator devices. In terms of heart stuff, the full gamut of vascular surgery is now at the Sussex campus.
Wow.
So they're able to do aortic aneurysm repair, open or endovascularly. TCAR, which is a way of carotid stenting with a device that reverses the flow and cuts all the schmutz that comes off of it, is what I like to call it. Stuff that would normally go up into your brain and potentially cause more strokes, it now gets caught in this system, and it's the new wave of doing things. And we've had a really successful TCAR program that started here in 2020. So we've really been hitting the gas here in cardiovascular services, especially to make sure we're bringing all the latest and greatest. But again, I can't stress it enough that we're having excellent outcomes. So even though we
That
are
is really
low,
important.
we are
Yeah.
low volume, in some instances, our outcomes are fantastic. Our TAVR program, which is that aortic valve replacement, is one of the only certified programs on the whole peninsula. So
Wow.
yeah, Del Marva. Yeah,
Yeah,
there you
wow.
go. I'm learning.
Exactly.
So it's really a big deal, and we really are really excited about that. And so again, it's about the outcomes, and every service that we offer in the cardiovascular service line is accredited, from echo to like getting ultrasound of your heart to getting stress test and nuclear medicine test. That's accredited. Cath lab is accredited. Electrophysiology is accredited. TAVR's accredited, cardiac rehab's accredited. So it's the full gambit. And the reason I did, not me, it wasn't me, our team, and I really pushed it, is we have to prove to our community the confidence to come give their loved one, or give us a chance to take care of them or their loved one. And I really think it's really something to hammer home to the community is, we have excellent outcomes here. We can take care of the majority of heart problems and vascular problems, and we continue to grow our bench with adding more vascular surgeons and to our cardiovascular team. So it's a really exciting time here at Bayhealth, especially in cardiovascular. So
Great.
You make a great point that, you're trying to convince the community to put their trust in you.
Yep.
And I've mentioned this previously, but I feel like when you live in a city, you go where your doctor tells you to, or you can research a little bit more, and you go to, whatever hospital is best for cardiology or whatever it is. Here in central and southern Delaware, we're a little slow to leave the whatever hospital system we've been a part of. And I'm not saying that, one is better than the other, but it's okay to be a consumer and to really decide, you know what, I'm going up to Bayhealth for this, and maybe you still stay at another system for something else. But and we all now talk during charting. The charting systems tend to talk to each other fairly well. But yeah, you'll hear people say, well, I only go one place, and it's like, well, yeah, but the services are there, go ahead and try it. And it's great to hear how we've expanded to the South, because I do remember anecdotally growing up in Southern Delaware, if you needed something heart related, you went north, and Dover actually being one of them. I remember people saying if you need heart, you go to Bayhealth, and that's really great. But to hear that there's those resources further south, so that you don't have to make the long trek all the way up to Dover.
And we've
And
talked about that on other episodes
I'm
too.
saying that with sarcasm,
Yeah, no, I
because
get it.
anyone who's not from Delaware is like, 45 minutes is not that far.
Uh-huh.
But for those of us in Delaware, it seems like it's a whole day trip.
Well, you get spoiled. You get spoiled. I feel the
Yeah.
same way. Now I'm like, oh, traffic. My goodness.
Yeah.
But
Yeah, you plan those trips up to Dover, you plan on, getting lunch out and then, whatever it is.
Yep.
But that is really wonderful to hear that, these services are available at both campuses, which makes it more accessible. My family has certainly used cardiology services in the past year, and it was great to be able to go to Route 9 for follow-up or to go to Milford for testing versus all the way up to Kent or vice versa. So that's wonderful. That's really great.
Well, the other thing you mentioned, consumers, they're all moving here too. A lot of these
Oh,
people that are retiring to Southern Delaware, they are used to an academic medicine like a Penn or a Jeff,
Absolutely,
right on every
yes.
corner. There's a great hospital in every corner.
Or
in
an
the city.
NYU or
Yeah,
Columbia.
exactly. So
Yes.
they're coming to us and say, where do I go? And they just
Yeah.
don't know that they can actually, they're like, I still drive. I've done some community events. And they're like, I didn't know. I still go up to Jersey to see my cardiologist. Who
Yes.
can I establish with? So it's really, we have a great opportunity, and it's really, it's right there for the taking, and we're really excited to do that.
Yeah. And I've found that getting an appointment is, obviously you might have to wait sometimes, but for the most part, we have utilized these services a bunch in our family this year, and we've been able to get in, and it's not because I work at Bayhealth. So that's something to note, because that's another reason why those who have moved here still go to New Jersey or wherever it is, because they feel like, well, I can't get an appointment.
Yeah.
Right.
Yeah.
Give us a try.
Yep, definitely.
So yeah,
If you're listening.
if you're listening.
We are committed to you.
Yes,
committed.
we are committed.
Absolutely. Yeah, absolutely.
Well, we are getting to the end of our time. Is there anything else that you want to share? Anything that you're excited about?
You want to go?
Go ahead. You can go, and I can wrap it up.
I don't have much.
Okay,
you
fine.
I'll piggyback on you.
All right. So I just, again, I've said it several times, but you do have excellent care here right at home. We truly are committed to our community. We've shown that through trying to prove that, and the proof is in the numbers and in the pudding. And we're happy to share that with anyone if they would like to come and give us a chance and talk to us. So, but one of the things I just also want to share is just we're very lucky. Bayhealth is a fantastic place to work, and I'm not just saying that because they write my checks. I've worked at lots of different institutions, and for those that have grown up in Delaware, I can't say it enough. They treat you are not just a number at Bayhealth.
Absolutely not.
And it's fantastic. So a little plug for Bayhealth. Great job. You guys are awesome. But also that from the outcome stats perspective, and back to the cardiovascular piece, you give us your heart, we'll take really good care of it. So.
Oh, that's.
Yeah.
If that doesn't sell anyone, I don't know what will.
I know that's a way to wrap this up.
Absolutely.
Well, this is our last episode of 2024.
It is.
And what a way to end. And I will say that there's certainly been a theme this season that we've met with a number of physicians and departments that you can tell that Bayhealth really does, that you are not just a number. We've heard of doctors that share their cell phone numbers, or, nurses whose passion is to come to work every day.
Exactly.
And so I feel like this season has just been a really, really inspiring season. And we'll see you again in 2025. We're
See you in
already planning.
2025.
So
Yep.
thank
End
you.
it with heart.
Yes. Thank you so
Yeah.
much.
Thank you.
Thank you, guys.
Appreciate it. Thanks for having us.
Yeah, thanks a lot.
Thanks for joining us on Scrub In, a podcast on humans, heroes, and healthcare. If you enjoyed this episode, be sure to subscribe and follow us wherever you listen so you don't miss what's next.
Please leave us a review, tell a friend, and come scrubbing with us next time.